I'm Michael Laine, and joining me today is Dr. Val. Dr. Val is a naturopathic physician and a certified emergency nurse, retired. How's that sound, Dr. Val? How you doing today?
That sounds good. I like the retired part.
I thought you
I'm
would,
supposedly retired. So
yeah. Supposedly, yeah. That's why I kind of emphasized it a little bit.
Yeah. I'm good, Michael. How are you doing?
I'm doing fabulous. And our topic today, which is one that kind of relates to, I guess, my gender a little bit, is I guess we're going to talk a little bit about prostate today.
Indeed, we are.
And let's jump right into it. So, what is the prostate and its main functions?
It's part of the male reproductive system, and it produces a lot of the seminal fluid that the sperm float in. So the testes alone do not produce all of it. You need the prostate too.
Yeah, then that was news to me. And I'm a male and I got a prostate, and I didn't even know that. So as you say, learning something new every day.
That's right.
What are the main issues that the prostate can cause as men age? I know some of them are typical, some not so typical.
Well, I'm going to start this off with talking about jokes that have been made about people as they age, like, where your skin forgets its original position.
Yep.
It's kind of like that. Your prostate kind of forgets its original position, and it's normally sitting right below the bladder, and it kind of wraps around the urethra. So this is the main problem that most men are going to notice, is all of a sudden the flow of urine is constricted and your bladder's full. You can't go. It's like, what in the heck has happened? And normally that happens, anywhere from age 40 to age 60 in most men. And it is a pretty natural thing that happens, but it doesn't have to. Now, you would think with the pain and stuff that happens when that happens that the prostate is huge, but it's not. It's about the size of a walnut shell. And sitting just around the bladder like that, wrapping around the urethra, that's the problem that happens with aging. Basically, because when the prostate gets inflamed, it swells and it pinches down on the urethra. So that slows and decreases the flow of urine. And then emptying the bladder becomes difficult and often painful. So what is this mysterious organ that causes problems for so many men? Yeah, prostate is what produces the seminal fluid and the sperm that are gathered in the seminal vesicles and sit on sort of on top of the prostate. The seminal vesicles are like, they kind of remind me of kind of some of the back tendons of a chicken.
Oh, that's interesting.
I don't know if you've ever butchered a chicken, but they're kind of long. They're kind of long and stringy, and they have like a little kind of a lumpiness, to one part. So they're sitting on top of the prostate, but below the bladder, and they're small. They're not huge. You don't usually have a lot of problems with those, but they're very important because if you want to create babies, you're going to have the sperm able to flow. You're going to have seminal fluid. And, that's just the way it goes because, the tadpoles have to swim.
Right.
So you got to have nutrient fluid that is going to support them and help them to move. So that's basically what the prostate and the seminal vesicles are all about. And what else can I say about that? Oh, the problems. one of the big problems a lot of people, including doctors, don't really think about is because the back wall of the prostate and the seminal vesicles lay up against the front wall of the rectum. And that's where cancer usually starts.
Oh,
Now, we're going to talk about that a little bit later. How does that happen? But this is something I want you to get this picture in your mind. Okay.
I'm visualizing now.
And this is why, I'm sure as a man you have experienced the finger wave, the digital exam.
Yes, that is so enjoyable. Yeah.
Oh, yes.
Yeah.
Yeah, I've heard.
Yeah.
And the reason that you can examine the prostate through the rectum is because it is right up against the rectal wall. But think about what else is up against that. If you're a meat and potatoes guy, and that
I
stuff
was
doesn't
for a
get out of
long
your body
time.
quickly,
Yeah.
yeah, whatever's in there well, it doesn't have to, but a lot of times it will kind of go through the wall.
Really
Yeah, from the rectum into the prostate. And so that can cause a whole lot of problems. We'll get into that in a little bit.
interesting.
Mm-hmm.
And then the whole thing, sometimes makes one, the design of everything down there, for lack of a better word, because I said the prostate, it wraps around, our urethra, so it's just like, okay, that design there just said, so the minute it gets inflamed, yeah, like you said, it starts, squishing down on the urethra and restricting urine flow. And in some cases, totally, stops it,
Yeah.
luckily, I have not experienced that much. I have experienced some minor restriction now and then, a little, getting up in the middle of the night a little more often than in my youth. The whole thing kind of strikes me as kind of not very well designed, for lack of a better term.
Well, it was well designed before we started putting all these weird chemicals in our bodies.
There you go. Yep.
Mhm.
Yes. And so chemicals being, as we get into chemicals like coming from food and everything else, I'd like to say, so how does diet affect the prostate?
It has a lot to do with it. In fact, it all seems to be related to the diet. So now when I'm talking about diet, we're talking about the standard European and American or developed nations, first world, high fat, high protein, high starch diet.
Right.
Yes, guys, it's all about your favorites, meat and potatoes and breads. So I was looking at the statistical reports from Europe and the USA and other countries. Europe and the USA have the highest incidences of cancer diagnoses, but the deaths are only slightly higher than most other countries, except Asia and Africa. In those two countries, diagnosis is a fraction of that, but deaths are just slightly less than diagnosis in Asia, more than twice the diagnosis rate in Africa. So, yeah, diet. If you look at what happens in Asia, they eat pretty much a more clean diet, or they
Right.
used to, and didn't tend to get all of the diseases that Americans tend to get, and tend to have much more healthy aging. But Western world stuff, we like what we like, right?
Yep.
And so, whatever you get used to eating when you're growing up is pretty much what you continue to eat as you get older. And, we're no longer working on farms and ranches for the most part. We're not out running after our prey. We're not, searching through the bushes for berries and other kinds of plants that we can eat. So because of that, we're really still trying to eat that farm or ranching diet, and it's a problem unless you're really, really active. So, you look at the diets and the incidents in the different countries, and you start to see some correlations, and especially with prostate health. And Japan actually does better than any place else. And remind me to talk about that a little bit later, because in the treatment segment, there's some things that I can suggest for people to do, but it comes with a lot of caveats,
Okay. Yeah.
and the caveats are strictly social. You know?
Oh, see. Okay.
Yeah, it's very interesting what they do in Japan that to keep their prostate health. So
Oh,
we'll get into that.
it's circling back a little bit. What surprised me is Europe. So you said Europe's kind of clumped in there with the United States here
Hmm.
on their diagnosis. Because I was always under the impression that while European food, it is, yeah, probably high fat content and just like ours and this and that, but they don't put the chemicals in their food like we do here.
Well,
And
they didn't used to.
then used to
Yeah,
has that. So apparently that's increased.
it could
Um,
be, but there's other factors too. They smoke more and they drink more as well.
okay.
And plus, they're oftentimes in high stress areas. So, stress has something to play with any kind
Yeah,
of disease.
it does. Yeah, stresses a lot.
Yeah.
So, what would be the most common tests for prostate inflammation?
Okay, this is the scary part that freaks people out. And so, prostate problems are usually found by a combination of two things. So, there's the infamous digital exam, finger wave,
Yeah.
and there's the PSA test. Now, one of the problems with the PSA test is that even though it's been around for about 30 years, it's not really accurate. And so they've tried, several other types of things to try to diagnose better. But still, it's the test that everybody uses as their first screening test, along with the finger wave.
Right.
Now, let me explain about the finger wave a little bit. When you do that, when you go in through the rectum, you can press the finger up against the prostate. And again, it's about the size of a walnut, you know. So you're pressing your finger there, and it's also like elevated a little bit on the sides. So it's kind of like almost like a butterfly.
Right.
So if a butterfly and a walnut mated and had progeny, it would kind of look like that, you know. But it has a feel that's kind of like a kidney. So like, if you're pulling giblets or gizzards out of a chicken, the kidneys have a really firm texture and they're kind of fibrous on the outside. So it feels kind of like that. So what you do with the finger wave is you're running up one side and then up the other side and around the sides. What you're looking for is nodules.
Oh,
And
okay.
so you want to test the firmness of the prostate. It shouldn't be really squishy.
Okay.
So like if most of it is fibrous and then you got a really squishy portion, that's a cause for concern. Same thing if there's any nodules, lumps, you know, any if it's really misshapen as well. So those are things you're looking for with a finger wave. And if you find abnormalities doing that, then you're definitely going to be doing some more testing. So you usually look at that along with the PSA test. Now, the PSA test is a blood test. So it's measuring the amount of prostate specific antigen that's found in the blood. And rising levels are going to indicate prostate inflammation, possible disease. And I say possible, men. So don't freak out because it's not 100% accurate. So, you need to have more tests if you think there's a problem there. And I'll get into the stuff that I've done to diagnose, real prostate problems that
Okay.
most doctors do not do. So, those are the two primary screening tools for prostate problems. Now, normally, only small amounts of prostate specific antigen are found circulating in the blood. Most of it is found in the semen. So, high blood levels of PSA, even though it does not differentiate between cancerous and non cancerous conditions, is a concern. And so, the things that can cause that, enlargement of the prostate can cause that elevation, as can infection or any inflammation. And diet, back wall of the prostate, front wall of the rectum,
Right.
inflammatory substances in the diet, sitting there, especially these guys that don't poop but maybe every couple of days,
Oh,
things
yeah.
can migrate.
Yep.
especially nowadays with all the chemicals and heavy metals that we get in our food and in the air and the water and everything else. Not to mention all the poisonous chemicals that, that you could come in contact with. So that's where the digital exam findings are helpful. So now all this is important because prostate cancer usually develops very, very slowly over many years. You could go a lifetime and maybe have a little bit of prostate enlargement, maybe have slightly high PSA and never develop prostate cancer. On the other hand, you could have low levels and no obvious findings on the digital exam and yet have prostate cancer. So you can kind of see the problem with that.
Yeah.
Yeah. So just not diagnostic. The problem is that if you don't get it checked out and it is cancer, then you got a real problem because from the prostate, it spreads to the spine and the brain. So it metastasizes. So this is why it's important for guys to get their prostate exams done.
Right.
Now, remember, a high level doesn't always mean cancer, and a low level doesn't always mean not cancer. Confusing.
Yeah, that is.
Yeah. But there are a couple other ways to possibly, I say possibly, diagnose cancer with the PSA test. So you've got free PSA, which is a high PSA but low free PSA, can indicate cancer. PSA velocity, which will track a rapid rise in PSA that may indicate cancer. So that's more blood tests, basically. And normally your physician will order repeat PSA tests to see if that is actually happening. And then there's PSA density. So that's a value measure for prostate and requires an MRI or a transrectal ultrasound. So now there are no absolute normal levels for PSA in blood, but there are general ranges that are considered normal. So testing is suggested to start around age 55 unless there's a history of prostate cancer in a direct relative, especially if two or more. And also African Americans carry more of a risk of aggressive prostate cancer. I do not know why.
I've never heard that.
Yeah, I hadn't heard that before either, but apparently this is becoming more common. I don't know.
Any thoughts on why all of a sudden it just started becoming more common with African Americans?
I have no idea. I didn't see anything pointing to that. All I saw was that, yeah, they can have more aggressive prostate cancer.
Huh.
So now here's the other thing. This drives me crazy. And I'm going to tell you why in a minute.
Okay.
Okay. The general conventional medical thinking is that most men will get prostate cancer if they live long enough. Now, I have a problem with that.
Yeah, I don't want to hear that.
I have a problem with that. Same reason that I have a problem with the conventional doctors that state that estrogen causes cancer. And
Right.
It's like, no, that's not true. Because if it was true, every person in the world would have cancer. Because men and women both have estrogen.
Yep.
And we both have testosterone.
Yep.
So, when they make these kind of blanket statements, it just really irritates me.
Right.
Because it's not true.
Right.
But the thing is that they put that brain worm in,
Yep.
and it goes around in your head and you're like, oh no, I might get that. Well, stop thinking that if you're one of those guys that thinks that, okay? There's no reason that you have to get prostate cancer. So there's things that you can do to make sure that you don't. But let me give you the PSA test ranges. So age 40 to 50, 0.6 to 0.7 nanograms per milliliter is considered normal. Greater than 2.5 is considered abnormal. And age 60 plus, 1 to 1.5 nanograms per milliliter is normal. Abnormal is 4 or above. Now, if a normal test rises more than 0.35 nanograms per milliliter in a year, further testing is recommended.
So with all these tests and further testing is recommended? I mean, basically, the two tests are still doing a PSA and the finger wave, correct?
Well, those are the screening tests.
Those are the screenings. So
Yeah, further tests
what
would
tests?
be they can look for further cancer markers in the blood. They would also want to do a probably a PET scan or an
Okay.
MRI for soft tissue development. Um, they would want to see if there's any abnormalities there. They would want to do a biopsy.
Okay, that
And
makes sense. Yeah.
yeah, and a biopsy is where they basically take a needle and punch a hole in the prostate and
Oh,
yeah, and withdraw tissue. And they take that tissue section and look at it under
that
the
sounds a little
microscope.
painful.
Yeah,
Ah, yeah.
yeah. And personally, I'm not a fan of punching holes in people and their
Yeah.
various organs and things unless it's absolutely necessary. And it's like, sure, they can do it. Yeah, but then that's another avenue for infection.
Yeah, exactly. Yeah, I mean, and everything you just said, I mean, with all the screening, PSA, and there's no absolutes really. It's kind of like they're just it's
They're
I don't
doing
want to
the
say
best they can.
they're doing the best they can. Yeah, I was gonna say I don't want to
Mm.
say willy-nilly, but almost kind of a like you'd say an educated guess on stuff. They just um and that's probably the scariest part, with being a man, that when you go get a lot of this testing, that like I said, a lot of it doesn't mean you have cancer, even though it sounds bad. And then if you walk out of there thinking you just had a healthy screening, doesn't mean you're out of the woods. Um, I mean, those are things that go through my mind, being
Yeah,
a man, having a prostate, that it's just, that it's not so black and white or cut and dry.
yeah, it's not. And I mean, the thing is that, like anything else, when you're talking medical stuff and health, every person has to take personal responsibility for their health,
Right.
and they have to know more than most doctors are going to tell you. So this is where you really have to do some research. You have to look into, what are the tests that they want you to take? Why you taking those? What are they looking for? And then you need to get into, what treatments are available. And do you want to do those treatments? I mean, there's all kinds of stuff that they will do that I would not necessarily recommend.
Well, let's
But
talk about that. What are the conventional treatments?
conventional treatments are surgery, radiation, and or chemotherapy, plus hormone therapy. Now, there's
Wow.
a whole bunch of them. And rather than going into that, I'm going to give you a place that you can find some further information on conventional treatments, including grading of the cancer, symptoms, etc. So if you go to https colon // www.cancer.gov/types /prostate /patient /prostate treatment dot pdg, yeah, pdg. There are pages and pages and pages of information. It's actually a really good site to research.
Hmm.
So yeah, that will contain all of the conventional treatments that are available out there. And I can tell you, when I say radiation, what they normally want to do is they want to insert about 20 radioactive needles into your prostate.
Oh God.
Yeah. And I've had several men that came into my practice years ago that were supposed to go get that done. And the first thing I did was run a complete hormone panel on them. And we're not talking male hormones, we're talking just hormones. Male,
Okay.
female, doesn't matter.
All right.
Wanted to know what the hormones were. And I'll get into that when we go into the alternative treatments.
Well, and speaking of the first, because the first three treatments, I mean, that's standard procedure at least in this
Yep.
country, for any kind of cancer, surgery, radiation, chemotherapy. I'll admit the hormone therapy catches me a little off guard there. I didn't realize the hormone therapy would be something it's that specifically related to prostate.
Yes, and there's a little more complex than that. When we get into the alternative treatments, I'll explain that whole thing.
Okay, well, let's get into the alternative treatments and
Okay.
what do they entail?
Well, that could involve some or all of the same treatments as conventional, or none of those treatments. So you're looking at acupuncture and oriental medicine, also known as Chinese traditional medicine. Naturopathic, chiropractic, homeopathic may be used singly or combined. Mind-body techniques are important, including yoga, meditation, frequency medicine, and healthy lifestyle changes. And any traditional or natural medicine approaches recognize that each person is an individual and needs to be treated as such. In other words, what works for one may not work for all. So when it comes to a possible cancer diagnosis, my first step is to get a complete hormone panel, almost the same as I would run for women. So sex hormone, binding globulin, fractionated and total estrogens, free and total testosterone. And I also want to rule out an infection, so a urinalysis after prostate stimulation. And then while you're awaiting results, you work on lifestyle changes. Now, the hormone stuff is very important.
Okay.
The reason is because there's a thing called aromatase enzyme. And aromatase is something that that comes into the body through all kinds of things. So it can be just from becoming obese. It can come from the foods that you eat, which is the most common. So any kind of wheat and other grains, depending, on your blood type, especially. But it's very common to have smoking and alcohol making a difference. Processed foods, all kinds of things can increase aromatase. So what you need is an aromatase inhibitor. And this is where broccoli comes in. The reason that mom wanted you to eat your broccoli.
There it is. Yes.
She had no idea. The thing that stops aromatase, you can get a pill. They have aromatase inhibitors now.
Right.
But the thing that actually stops the aromatase action is broccoli essence. But you would
Nice.
have to eat a truckload of broccoli a couple times a day to get enough essence. So what you do instead is you just buy a supplement called I3C, or indole 3-carbinol,
Okay.
or DIM, which is diindole methane. Now, the I3C is the precursor to diindole methane. So you might have seen, DIM advertised all over the place.
I have.
And I think you and I have talked about the combination stuff. And
Yes.
yeah. Now, the reason that you want to go with I3C, if you can, is because it's cheaper.
Okay.
It's much cheaper. But the problem is, if you're one of those people that does not have the enzyme to convert I3C to DIM, in other words, you take it for a while and nothing happens, then you need DIM. DIM is way more expensive. But either one could work. I3C works in most people, has been my experience.
If you take the IC3, so what do you look to determine whether you go to DM if it's not working? What kind of symptom, or what are you looking for? What's a guy looking for when he starts taking IC3 to know that it's working?
You would check your prostate specific antigen level.
Okay, so you'd have to get a test.
Yeah.
Okay.
So it'd be a blood test. So I would test it like after a month and see if it's come down. If it hasn't, then you go directly to DIM. And what you're going to do is you're going to take it at the same time that your steroid hormones peak. So that's going to be 6 to 8 a.m. and 4 to 6 p.m.
Oh, interesting.
Now, I'll
Okay.
tell you a little story about what happened with one of my patients. I might have mentioned it before. This is an elderly guy who's 72. And he came into my office and his wife said, he's got something going on down there. And I said, okay, drop him. And I could not believe what I saw. His scrotum was like this big, and it was
Oh,
bright pink and shiny, no hairs.
oh,
And I was like, I've seen a lot of things. I have never seen that. I had no idea what the heck that was. So I sent him to the proctologist and to the dermatologist and MDs, specialists, and to the urologist. And they all sent him back and said, I have no idea what that is.
wow.
It's like, there's something wrong with this picture.
Yeah.
The naturopath sees there's something wrong, sends the guy into the MDs. The MDs go, I have no idea what that is. And I'm going, oh, great. So in the meantime, I drew this guy's total hormone panel, and his estrogen was like 450. I wish I had that high of an estrogen. I was like, oh my God. And so that's when I started thinking about the whole aromatase thing. And so I put him on a course with the DIM, and his prostate, his PSA level was just out the roof. It was huge.
Wow.
And so here he is with this really strange looking scrotum. And it took about a month, but his scrotum shrank down to normal and was no longer bright pink and shiny. And his PSA level came down to normal.
Nice.
And the hormones dropped down to normal. Now, what fools a lot of people is if they go in with something weird with the prostate, usually they'll test your testosterone. And so your testosterone comes back usually high, like, it might be 8 to 1200, which is
Right.
pretty high. But they don't check your estrogen. So they don't
Oh,
know what's actually happening with that testosterone. But what happens is aromatase comes along and it converts all that high testosterone into estrogen.
and estrogen. Yes.
Estrogen then causes problems with the prostate and with the testes. And so this is one of the things that leads somebody into cancer. So if you can prevent that with something as simple as I3C or DIM, why the heck wouldn't you do that? It's two little
Right.
pills, and you only need 2 pills once a day if your PSA is normal,
Okay.
if you're not having any symptoms.
Okay.
So, like I said, I3C is cheap.
Yeah. Yeah.
So,
Why not?
yeah, so you can go
So you
that
even
way.
take that even as preventative.
Mm-hmm.
Okay.
Sure. And then cut down on the things that actually cause aromatase to increase. And that's,
So
strictly
the
diet.
aromatase, is that what increased his high estrogen count?
Yep.
And what would cause that? Why did he have this sudden burst of the aromatase and estrogen? Was it a diet,
It
possibly?
happens to everybody. When
Yeah.
men go through andropause and women go through menopause,
Okay.
we switch. Like, women talk about how, we go through menopause and then we no longer feel girly. We don't want to put on the makeup and the jewelry and,
Right.
we don't want to do that. You know how much I complain when I have to put on makeup and do my hair for these videos.
I do.
Yeah. And, it's because I wish I had an estrogen level as high as that patient did, then I would feel like I wanted to do this stuff.
Right.
But that's because these things happen. And because the aromatase enzyme is going to cause this kind of a problem in both men and women, yeah, we could all do really well with doing I3C or DIM. So, I have one that's a DIM detox that's got a whole bunch of other stuff in it, and it does help. It really does. Otherwise, you'd be hearing flat out that no, I'm not going to go on screen.
Right.
It's just too much of a bother.
Yeah.
But yeah, so these are things that both sexes need to really pay attention to, but men particularly because if women get higher testosterone, it doesn't normally go to cancer. Whereas with men, if you get a high estrogen, it can go to cancer. Yeah.
Yeah. That's not fair. Yeah.
Yeah, well, I know.
Just saying, just an observation.
There's a lot of things women go through that aren't fair either.
This is true. This is true. So in
Well,
the end, it all balances out. Yeah.
yeah.
I have no doubt about that. So you mentioned the IC3 and we got the DIM. Are there any other supplements that can help, whether it be preventative or treatment wise, and any activities? And what else would you might recommend there?
Oh, sure. There's several things that can really help. Regular exercise is at the top of the list. Then you want a diet high in cruciferous vegetables and fruits, especially berries. You
Okay.
want to include selenium, vitamin E, zinc, lycopene, which comes from tomatoes. But unless you're a type O, don't eat tomatoes. Pomegranate juice and modified citrus pectin. You want to reduce stress. In other words, lower your cholesterol levels, or not cholesterol, I'm sorry, cortisol.
Cortisol. Okay.
Yeah. I still got cholesterol on the brain
I hear you.
from all that on those shows that we did. Then you want to clear the emunctory organs. That's an old term that just basically means make sure that you are peeing, pooping, and sweating as you should,
Right.
because this is where a lot of the problems for prostate come in. Men get all gunked up because they're eating stuff that is really not a good diet for them. It's like, yeah, you can eat the meat and you can eat the potatoes, but when you put them together, you cause problems. But they taste so good together.
I know. They do.
I
They really
know,
do.
believe me.
Yeah.
But yeah, so what you want to do is eat them separately. You know,
Okay.
have a nice baked potato or some fries fried in avocado oil, with a salad. Have a
Right.
steak with a salad or with beans or something. But
Right.
yeah, so you kind of have to learn to eat a little bit differently to take care of that. And you want to make sure that you're pooping. If you're eating 3 meals a day, you should be pooping at least once.
At
I mean,
least. Yeah.
at least. I mean, I can tell you that I've taken care of people when I did home health. I, it's too gross to really go into, but let me tell you that if you haven't pooped in a month, you got a problem.
Oh gosh. I
Oh
couldn't
yeah,
imagine.
and the
Wow.
hospital will send people home like that.
That's horrible.
Oh yeah, and then the home health nurse has to disimpact that patient.
Oh gosh.
Oh yeah, bad for the patient, bad for the nurse.
Bad for everybody around. Yeah. Yeah.
Yeah,
Yeah.
yeah, it's really rough, and that could be prevented. But one of the things that causes that too is if you're on opioids, opioid pain relievers will slow down your gastrointestinal function very, very much.
Oh.
And I can tell you that I have taken care of a patient in the ER that had a 25-pound poop.
Oh.
Oh yeah,
Oh. That sounds like that would just be so painful to even.
yeah, yeah. Well, this has been going on for a long time. He was a heroin abuser,
Wow.
and yeah, this is the kind of stuff that can really get you sick. Beyond just what the drug can do by itself. But I mean, to block your emunctory organs is one of the sure ways to get cancer.
Right. Well, yeah, you're
So,
holding in all that toxin.
yeah, because there's toxins in all kinds of food. There's even plant toxins that we
Yeah.
shouldn't be eating. Like there's I think a couple books out about the superfoods and how they're actually toxic. And it's because the plant is trying to keep you from eating it.
Yeah.
So yeah, there's all kinds of toxins that come in all kinds of different ways. So if you're one of those people that's constipated, that's your first thing to do. Take care of that. Okay.
Okay.
And there are many things you can do for that. The easiest thing is to get some oxy powder from globalhealing.com.
I could vouch for that. It works very well. I love that
Yeah.
stuff. Yes.
Yeah. And it's easy. I mean,
Yeah.
there's intestinal cleanses you can do and all
Yeah.
kinds of stuff like that. And this is something that most men need to do.
Yeah.
And in fact, when men are frustrated, they get that big belly that looks like they're pregnant.
Yeah.
It's usually pounds of poop that's stuck in there.
I've heard, yeah, countless stories of how many pounds are enlodged into the intestine, especially,
Yeah.
as people age, and probably more so, I know, with men. Yeah, and they end up dying that way. I mean, I remember hearing years ago, I think about with John Wayne, I'd heard a story, something that when he passed, he had, something like 75 pounds of fecal matter in him or something ridiculous.
Yeah.
Don't quote me exact, but I remember it was just a ridiculous amount, when he died. And, darn well it's John Wayne. He was a meat and potatoes guy all the way.
Oh, yeah.
you
And a
know,
smoker too. So,
yeah,
there's
yeah,
more toxins.
yeah.
Yeah.
So yeah, I see it's very important to bowel movements. Got to keep things moving. Let that poop go.
This is a pretty poopy conversation.
Yeah, it is. But I guess it's part of the territory. It goes with the territory, I guess.
Yeah, I mean, you really do have to take care of these things. We should do a
Yeah,
show on the whole gastrointestinal tract,
I think that would be a
clearing
good
it out.
one. Yes.
Yeah. We're
I've,
we're coming into spring and summer, and that's
yep.
time to do fasting and cleansing.
Yep.
So yeah, maybe we should hit that next, because this is so vitally important to your health. And I've done all kinds of cleanses and detoxes and all kinds of stuff for about the last 40 years. And I can tell you the first one that I did was astounding. And I mean, the stuff that came out, and I hallucinated, and
Wow.
yeah, it was really weird. And the thing is that when you don't know about this stuff, and if you're tight in the conventional medical realm, then you probably don't know about this stuff.
Right.
But the thing is that I didn't. I was an ER nurse for many years. And if you are taking any kind of pharmaceuticals, that stuff can actually get stuck there. And the first couple of cleanses you do, you will realize how many antibiotics and how many antifungals and antiparasitics and everything else that you took, because you'll smell it. I mean, it's pure chemicals
Oh,
that
wow.
comes out the first couple of cleanses if you're in that situation. And I was, because we all got sick every month.
Right.
It was just whatever was going around, we all got it. And so we were all in antibiotics and anti this and anti that. And boy, I'll tell you what, the first couple of cleanses I did, it was eye watering.
Huh.
It just was tough to be in the room. It was pure chemicals. And so if you got that kind of stuff going on, remember again, back wall of the prostate, front wall of the rectum.
Yeah. Very closely related there.
Yeah. So
Yeah.
all that stuff is going into the prostate. So
That's why we need
eventually,
to do a cleansing show. Yes. I think
yeah,
that would be a very
absolutely.
good one. Yes.
Yeah, because any toxins that are stuck in there, and if you're constipated and you don't go for a couple days or more at a time, then that's plenty of time for toxins to
Yeah.
leak into the prostate.
No, that makes total sense. Yeah. No,
Yeah.
you got to be, people need to get their bodies where they're at least going, at least, like you said, at least once a day minimum.
Yeah. If
Yeah.
you eat, should be. Yeah.
Yeah.
Okay. Then the other things that you can do is, before you go have a PSA test, no sexual activity,
Wow. How come?
because that's going to give you a higher PSA
Really?
if you have sexual activity. Yeah.
Interesting.
They
Huh.
don't tell you not to do any
No,
sexual
I have
activity
never heard
48
that.
hours before. And that may be why a lot of men have a high PSA and no symptoms.
Yeah.
So yeah, so be careful.
Okay.
No sexual activity, and that means none.
None. Yeah,
None.
absolutely. I
Yeah,
got
not
you.
even by yourself.
I got you. Point taken.
Okay. I like to make sure I'm really clear about this stuff.
You're crystal.
Okay, and then you hold off testing if you have a UTI, urinary tract infection.
That would kind of make sense to me. Yeah.
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 Although most guys usually don't get urinary tracts as often that I'm aware of,
Yeah.
compared to, with women. I know women usually a little more. I see women drinking cranberry juice a little more because of that.
Yeah, it's because you guys have outies and we have innies.
Exactly. Yeah. That's what I've always tried. It's the Audi innie. Yeah. Yeah. Scenario. Yeah. Audi
Uh-huh.
and an innie. I wanted to circle back because you mentioned on the lycopene. I know lycopene, yeah, like it says connected with tomatoes,
Mhm.
except if you're type O, because I'm type O, so you're okay to you
Tomatoes are
don't
fine for a type O,
type O, but not
not
for the
for
other
any
type.
other blood type.
Okay. Okay. I'm kind of surprised actually that tomatoes are good for type O's, since
Yeah.
that's the carnivore, kind of like more or less the carnivore type blood type.
Yeah.
Okay.
Yeah. Tomatoes are fine. And then sometimes it's okay for somebody who's another blood type that actually had a type O parent.
Oh, really?
Yeah. Sometimes you just have to kind of test it out yourself and see. Easiest way to do it is learn dowsing and, douse yourself.
Okay. Yeah, let's see what works. Yeah, the body will tell you. I know
Yeah,
that.
it
Yeah,
will.
it will. It will.
If you want super health, you need superfoods. Introducing the top 4 supplements you need now to transform into your superhuman self. First up, Shilajit, known as the destroyer of weakness. This ancient superfood from the Himalayan mountains is packed with 84 of the 102 minerals that your body needs. Next is Pearl Powder, an underwater superfood, sustainably sourced. It supports your hair, skin, eyes, and nails, enhances brain function, improves sleep, and may help alleviate skin ailments and even brain fog. Then we have reishi and turkey tail mushrooms, antioxidant-rich adaptogens that calm your central nervous system. They reduce stress, improve sleep, lessen fatigue, support your gut health, and enhance your immune system. Finally, we have dragon's blood, a powerful superfood from an ancient tree. Studies show that it can help regenerate collagen and tissue, support blood health and cognition, and promote healthy skin and gut flora. Unlock the power of these ancient superfoods to elevate your health. Visit us at thewonder.network and take 10% off your order with code WONDER10 and jumpstart your super health today.
So, you mentioned kind of those are kind of the most common ones. You can, treatments, this and that. So, speaking in terms of cancer and even cancer prevention, whether it be prostate or anywhere, there's things out there that I think many of us are aware of that aren't necessarily publicized, and some of us aren't aware of. But you hear a lot about vitamin B17
Hmm.
being having let's say favorable results against cancer, and also ivermectin. And those ivermectin and fenbendazole, I'll throw in there with the ivermectin. Would those help with anything to do with the prostate?
They can help. First of all, B17 isn't actually a vitamin. They call it that, but it's
Right.
actually a miculin, and it comes
Okay.
from bitter apricot seeds,
Right.
which are African, actually. Um, and it contains a form of cyanide. And this is found in many seeds and nuts, some more toxic than others. So caution is advised if you're going to take that. And the normal amount suggested is 3 to 5 of the seeds per day. And the
Okay.
whole reason is because if you mistake them for normal almonds, they look like almonds. They're
Right.
slightly smaller and they taste very similar, but they're a little bit more bitter instead of sweet. But if you mistake them and you eat a couple handfuls of them, you're going to get a dose of cyanide.
Oh.
So, yeah, and that can happen with pretty much any seed. Some are more toxic than others. I remember years ago, gosh, this had to be back in the 70s or 80s. They were talking about a guy that had died because he ate a full cup of apple seeds. He loved apple seeds. So
Oh.
he saved them up and ate a full cup and he died of cyanide poisoning.
Wow. I never heard of that. Wow.
Yeah.
I've
So, like, just because it's a seed that you would normally eat the fruit of or the vegetable, it doesn't mean it's necessarily safe. Look into that stuff.
Well, yeah, and I eat a lot of nuts and seeds.
Yeah, me too. They're
Not
excellent.
I admit, not apple, but a lot of the other ones, typical ones. Yeah.
Yeah. So, yeah, use a little bit of caution with that.
Okay.
If someone has prostate cancer, you'd want to be taking a whole lot more than just that and should be under the care of a good holistic doctor.
Okay.
Anytime you got a cancerous state, don't try to do this yourself unless you're a doctor and
Right.
you're, well aware of some of these things.
Right.
But, most of the time, like I've taken care of other doctors that have had cancers and things like that because they only know, if they're conventional, they only know their side of the stuff. They don't know my side of the stuff. And, and I go to doctors myself. I mostly go for diagnosis.
Right.
I've got something going on. I'll go, I wonder if I have blah, blah, blah. And then I go see a conventional doctor to find out if what I think is going on is going on. And if he agrees or she agrees, then I go home and I take care of it.
Right.
Which frustrates the heck out of them because they go, well, you get all these symptoms, but then you never go into the full-blown disease. It's like, yeah, that's why I came to see you. So I know what the diagnosis is. I've confirmed it. And I go home and I do the things I know how to do to get rid of it. That's why you don't see me going into this disease state. And they just shake their head. They don't understand, But people can do this too. Some of the stuff you can do yourself. You don't always have to go to a doctor. But, like I get a lot of people on the chats that have asked me, well, I've got this and that and the other, and what do I do? And I go find a doctor.
Yeah.
Don't mess around with this stuff.
Right.
Some things that you want to change your diet, you want to get healthier. Yeah, you can do that yourself. When you're talking about cancer or something that's going to kill you fairly quickly, don't mess around, especially prostate cancer, because you got to remember, if it goes to cancer, it's probably been growing in there for a long time, maybe your entire life. So at what point are you going to flip over into the deep end and not be recoverable?
What about would parasites contribute to that? And could you doing a parasite cleanse help?
Yes, it could. It could, because parasites will cause a problem throughout the body, and they're putting more toxins in there.
Right.
And the parasites can come in with your food. They can come in if you're swimming in a stream or a lake.
Right.
They can come in from the dirt. There's all kinds of ways that we get parasites. Everybody,
animals too, or pets. Even if you have a pet, off your pets.
Yeah.
Yep.
Everybody's got parasites. They just don't normally cause a problem. And I mean, I've had a couple of patients that had parasites that were ignored by the MDs. And one lady died. And it was pretty horrific the way that she died. But the MDs had classed her as having delusional parasitosis. And they didn't even check,
Really?
that was pretty bad. And she ended up bleeding internally from all that crap.
Oh, that's horrible.
Yeah.
Wow. What a way
So
to,
this is normal stuff. I mean, it used to be way, way back in the biblical times. People knew this. And so they did parasite cleanses all the time because they knew they were going to get parasites.
Right.
They knew how bad it was. And so they did appropriate cleansing to get rid of the parasites. And like it used to be, I know when I was, I guess a child, and it wasn't me, but it was other people. I mean, there were kids that were on ivermectin at that time because they had pinworms, because their parents let them sit on the dirt all the time.
Right.
And they didn't have diapers on or pants or whatever, because parents thought it was great to have them running around naked, which is fine until they sat down.
Till he sat down. Yeah. It's great to air it out until you sit down. Yeah.
And there's pinworms in there. They will crawl into the rectum.
Ooh.
So yeah, ivermectin's been used for pinworms in kids for a long, long time.
Right.
like over 50 years. So yeah, you can use ivermectin, and I would do a course of ivermectin and fenbendazole.
Okay. Pair them up. Okay.
Yeah, because they both do different things. Yes, they're both antiparasitics, but they cover different types of parasites. So if you do them both together, you've got the broadest spectrum. And there's pros and cons to both of them, of course, because they are pharmaceuticals, but they're actually fairly safe as far as most pharmaceuticals go. So if you think you got parasites or you just want to do a parasite cleanse, then yeah, look into it. But there's also all kinds of herbal parasite cleanses that you can get, like wormwood is one of them.
Wormwood. I've done wormwood. Yeah, it works.
Yeah,
It's
wormwood,
great.
black walnut,
Black walnut's another. Yep.
pumpkin seeds.
Yep.
Yeah, there's all kinds of things that are known to expel parasites. And we should do a parasite show too.
We should. I've
Yeah.
actually got a parasite cleanse here in a box sitting here that I'm getting ready. I'm actually gonna start probably
Good.
when it gets close to the next full moon. I'm gonna start on a
It should be
parasite.
done twice a year at least.
I've even heard some cultures do them on the change of every season, which is 4 times a year. They do on the winter, summer solstice, and then your fall and spring equinoxes, and they'll do them on each one up to 4 times a year.
Yeah.
Yeah.
Yeah, because we get them in through everything, and look at how many times you eat out.
Yeah.
I mean, that's a good indicator of how much you need to do it, because if
Yeah.
you're eating out, do you really trust that food has been washed?
Exactly. You don't know what you're getting. You don't.
Yeah.
You do not. You're totally trusting the restaurant, what they're serving you.
Yeah, and the thing is that most produce, when it's grown out in a big field and you've got migrant workers out there, packing this stuff, here we're going to go back into a poopy conversation again.
I know right where I know right where you're headed with it.
Yeah, they're peeing and pooping right where they are.
Yep.
They don't go running off to the bathroom.
No, because the bathroom, it's a quarter mile down the road or whatever. They got an outdoor Sandy hut or whatever. They don't have one right in the middle of their strawberry fields or whatever it might be.
Right.
So yeah, they got to go. It's the old saying, when you got to go, you got to go.
Yeah. So this is one way that parasites get in too, because they could have parasites in them. They often do.
Yep.
And anybody that's working out in a garden, you should be doing this parasite cleansing a couple times a year at least.
Yeah.
So yeah, parasites can cause a problem. And a lot of them can travel right through your tissues. So could you get parasites in the prostate? Yeah. Are they going to cause problems? Yeah.
Yeah.
They're also going to cause problems all over the body. So,
all over the body. That's what parasites do.
Yeah.
What they do.
So if your prostatitis is caused by that, then yeah, sure, that will help. In most cases, that's, really not an issue for most developed nations, but
right.
Could happen.
But it's a possibility,
Yeah.
So
you want to look at all of the possibilities. Again, you got to take responsibility for your own health.
And that's the most important part right there. I think if there's any message you get across, take response. I mean, God, there was a saying I came across many years ago and always stuck with me that most people take care of their car better than they take care of their own body.
Yeah.
I mean, if you think about it, I mean, I know people that not only just washing and cleaning your car, but you're constant with your oil changes, changing out your filters and all that to get, cars cost a lot of money. So you want to get, the most out of them you can, get them to last the longest. But if you apply the same principle to your own body, might be able to avoid a few things.
Yeah. Well, everybody's too busy. We're all too busy doing whatever we have to do.
Too busy taking care of their car.
Yeah. Yeah. So anyway, hopefully that information was enough to open people's eyes.
I think so. It's funny. We talked about fenbendazole because I got some right here that I use on my dog for, dewormer. I mean, you can pick that up and, it works great on them.
Yeah.
Yeah, it works great on them. Although I know some people have issues with stuff that are used in a veterinarian style to use it in a human form. But
It's all the same stuff.
it
It's just
is.
labeled
It
differently.
overlaps. Yeah, it's just a matter
Yeah.
of a different label being put on
Mhm.
it. So,
Yeah.
but no, I think this is great information, Dr. Val. I want to thank you very much
You're welcome.
for being here and sharing all that great information on prostate and the good and the bad on it. So I want to thank everyone for coming. I'm Michael Laine, and thanks for another show